everybody. Dr. Ben Emery is here from Aspen Ridge Dental. Welcome.
Good morning.
Now, I know a lot of people might have been grinding their teeth last night waiting for the presidential results, but today we're going to be talking about oral health in regards to pregnancy, because obviously moms-to-be have so many things to consider, so many things to worry about. Sometimes they might overlook just the necessities, the simple things, the oral health. So what do they need to keep in mind?
Well, you need to keep in mind that the mouth is the gateway to the body's overall health. So whatever your oral health habits are affect the baby's health in general. Even during pregnancy, the mom's oral health habits before pregnancy, everything that goes in and out of the mouth and the health of the mouth is what affects the overall health of the mom, and then especially when she's pregnant, the baby's overall health. And so the things that you can do obviously are brushing twice a day, flossing to remove the plaque accumulation that's on the teeth. What we find here is one of the most common side effects is what's called pregnancy gingivitis. And ultimately what it is an increase in hormones that make it more difficult for the body to remove plaque, which causes gingivitis. And the plaque accumulation on the teeth, which is a sticky substance left behind by bacteria, ultimately causes the gingivitis. So by mechanically removing the plaque, that's what decreases and eliminates the gingivitis, which also is the beginning stage of gum disease, which can lead to tooth loss in the future.
Absolutely. So you're almost brushing and flossing for two at that point. So make sure that you're staying on top of those habits, going in to see your dentist regularly.
That's right.
Those sorts of things.
Yeah, and did you know that the baby's teeth start forming between the 3rd and 6th month in pregnancy? So at that time, it's very critical to have good oral health habits. Seeing your dentist on a regular basis for cleanings, checkups, and sometimes your dentist will recommend more frequent cleanings.
Okay, and obviously the babies can't floss themselves, so you gotta pay extra close attention there. What sorts of problems do you see that moms-to-be have? Is it they're more focused on other things? Obviously, so many things on their plate at that point. How do you encourage mothers-to-be to keep up on these habits?
Well, make sure you're eating a well-balanced diet. You know, lots of leafy greens, high-quality proteins, carbohydrates, and making sure you're getting all your vitamins and minerals like vitamins A, C, D, and calcium. Just eating a well-balanced meal.
And earlier, you were kind of talking about the hormones associated with pregnancy. What does that do in the mouth? Does that increase your chances of getting cavities or gingivitis? No,
it just sometimes makes your gums swollen, red, and tender. And so the moms are less likely to brush their teeth and floss because it hurts, it's painful. And their gums bleed, you know, and it's just uncomfortable. Sometimes moms gag because they just can't handle the feeling of the toothbrush on their gums. And so we really encourage expecting moms to get a soft bristled toothbrush and really try to get in there and brush at least twice a day.
Maybe even some sensitive toothpaste in that regard then.
That can sometimes help also.
All right, so importance, put on brushing, flossing, going to your dentist, staying on top of the health, and you'll maybe have a nice smile for the 9 months.
And a healthy baby too.
And a healthy baby, you can't beat that. Well, Dr. Emery, thank you so much for coming in today and sharing all of these tips.
Thank you.